channel Bone Education.
Hello again to our channel Bone Education. As promised in our previous video, today I will briefly present you the common errors in DXA scan of the hip. Let's get started. Unlike the DXA examination of the spine, the legs should not be placed on a block but should be stretched out with the feet rotated inwards. If possible, the foot should be fixed on a block. Sometimes, of course, there are circumstances which make this impossible, for example, leg deformities. To achieve a correct positioning, the leg must be rotated inwards to the desired angle such that the shaft of the thigh bone, the femur diaphysis, must be placed parallel to the midline of the scanner. If your DXA scan was done correctly, regardless of the device model, the image should look like this. The greater trochanter should be clearly visible. Part of the ischium should be visible. The entire hip joint must be represented. If the femur is rotated inward correctly, the lesser trochanter should be briefly or not visible at all. The femur diaphysis must be in a straight position. The total region of interest of the hip consists of 4 smaller regions covering the following areas: femoral neck, the word triangle, the trochanteric zone, and the intertrochanteric zone. The femoral neck region of interest varies among different manufacturers. In this image, for example, the entire bone is indicated by yellow contour along the edges. Arrows indicate the femoral neck region of interest. The region of interest of the hip is more complicated than that of the spine because each manufacturer has different reference areas. Therefore, it is recommended to undergo follow-up measurements on the same device, since device algorithms differ. In fact, when it comes to quality assurance, 1 gram per square centimeter should be the same for each device, but it actually isn't. For example, here I will show you the difference in the region of interest of 2 manufacturers. Hologic places the region of interest of the femoral neck to the side over the trochanter, and General Electric Lunar centers it in the middle in the most narrow area of the femoral neck. The first type of errors in the DXA scans of the hip are artifacts. Artifacts may arise, for example, when the patient moves during the examination. Another type of errors is related to the inability to correctly position the patient. In case of unilateral valgus deformity of the hip, it is recommended to measure the other side as well for better diagnostic information. On the other hand, arthrosis may limit the range of motion of joints, reducing the internal rotation of the hip, making it impossible to not include the lesser trochanter in the image. The straight positioning of the femur diaphysis may fail too. Sclerosis of certain areas of the hip can lead to falsely elevated bone density. Here is an image of a patient with sclerosis of the intertrochanteric region as a result of a benign bone tumor. Paget's disease of both the spine and hip can result in falsely elevated bone density and T-score. This DXA image of the hip shows thickening and disorganization of the bone as well as widening of the acetabulum as a result of this condition. Marked in red, you can see how the T-score of the femoral neck is significantly higher than that of the other areas. Vascular calcifications, if extensive and included in the region of interest, may lead to falsely elevated bone density. Here, in this case, the calcifications are not included in the border of the region of interest and therefore they don't affect the result. Malrotation of the hip leads to positioning of the greater trochanter in the region of interest of the femoral neck, thereby falsely increasing its bone density. This effect is less important for the bone density of the entire femoral toe. A condition called panniculitis, characterized by inflammation of the subcutaneous fatty tissue and affecting different parts of the body, can affect the result of your DXA scan of the hip. Here in the image you can see how the bone density of the hip can change in the face of the panniculitis retraction. It is sometimes possible for the device software to incorrectly contour the bony edges of the femur. The T-score of the proximal femur is used for diagnosis, and the most suitable values for risk assessments are total hip T-score and femoral neck T-score. If one of the T-score values from the DXA examination of the spine, the total hip, or the femoral neck is below minus 2.5 standard deviations, the diagnosis of osteoporosis is made. That was all for today. I hope you found this video useful. Like and subscribe to our channel to watch more interesting videos on the topic. Stay tuned for our next video and see you soon.